watching SHEM Ministries, souls honoring Elohim's mandate. And now for today's message.
Hello, hello, hello. Welcome to SHEM Ministries. That is Souls Honoring Elohim's Mandate. And tonight, off schedule, is our SHEM 2 night. That is a spiritual, healthy, enlightening mandate ministry. And I am Dr. Anna Shaw Devlin. I welcome you into my home, my humble abode where I record. Yes. I am so thankful for having a job. Yes, there are so many people who do not have a job on tonight, and I had to work last night on my normal work schedule, which is fine, okay? But I didn't want you to think that I didn't broadcast last night because I just didn't feel like it. No, it's the holiday season, and most of the time, actually, my job entails that I work holidays. And so sometimes we navigate around those holidays and the schedule gets kind of messed up so that, same people don't work the same holiday and this, that, and the other. So I shifted. And so we praise God. We do not take it lightly. And we thank God that we have a job. Okay. And the main reason I say that is because until you are in a situation where your job is at risk or you're at risk of not having one, then we all of a sudden start thinking about what it would be like not to have a steady income. And we know income is necessary to live. There's nothing we can do today. We can't even go to a well and pump water to drink water without paying for the water. Isn't that something? But to God be the glory. Thank you for joining me. And tonight I want to present to you a topic I feel is befitting for this time of year. We want to talk about healthy aging. We want to talk about this because what's going on right now? We're getting ready to head into the new year. And what happens every year? The beginning of the year, we make New Year's resolutions. We say, and there's nothing wrong with it because I made some myself, okay? Yep. We make New Year's resolutions in which we say, I'm going to join the gym, I'm going to exercise more, I'm going to this, I'm going to that. And usually by the end of the year, let the truth be known, we abandon the initial and I'm going to start over again next year. Okay, so it is, hey, I'm guilty and I'm first to admit. So we want to talk about aging. And I want to remind you that from birth, the time we are born, the clock starts ticking. Yeah, it does. To our end. It may sound morbid, but it is what it is, right? Every man born shall die. And we are going to go into that scripture. But first, let's have a prayer. And I want to, let me start with a song. And then we'll pray. Because he lives, I can face tomorrow. Because All fear is gone because I know He holds the future, and life is worth the living just because He lives. Because He lives. Glory be to God. I can face tomorrow. I don't care what is going to happen on tomorrow. Because He lives. Glory be to God. All fear is gone because I know He holds the future, and life is worth the living just because He lives. Excuse me. Why did I start having post-nasal drip before I started to broadcast? I jumped up, ran, got some water, and in the midst of my song, I started having drainage. But guess what? To God be the glory. You know the song, the words of the song, let them resonate with you. Yes, we are talking about birth to death. And we're talking about healthy aging. Yes, we're going to age. You cannot prevent yourself from aging. I don't care how many plastic surgery, tightening up of the skin, the Botox, the fillers, the whatever you do, you dye your hair, whatever is done. And I'm guilty, but I'm still going to age. How many people say, girl, you don't look like you are such and such, or man, you look good for your age. Those are the things that we get excited when people say them to us. But the clock, the internal clock, the clock that God put on us from the time we were born, He knew the exact moment and hour we would end, leave. So during that time, we need to hear, know, and understand how to age. You know how people say gracefully. We, toward the end of our lives, need to be in a position, whether it's a sudden death or a prolonged death or whatever our death may be. We hear people say they died a good death, right? They died with dignity. Yes, that's what we want. They died peacefully. They left this world with a legacy, right? Oh, we want to hear all these things. But the thing that I want to hear the most is my God saying, well done, my good and faithful servant, right? That's the thing that we want to hear. what God has to say about the life that we lived. But I do need to remind you that the mortal body that we were given, we need to take care of it. So tonight we're going to talk about aging healthfully, right? The healthy aging process. And I got some help. All right. This little pamphlet is put out, Health Central Guide. And it is medically reviewed, peer reviewed, this, that, and the other. But I'm going to use it tonight because it's going to help somebody like me who gets stuck on a topic and can't get off of it. There's so many little things in this, but I want to go through them and we're going to talk about them. But first, dear Heavenly Father, I got tongue twisted. We give you all the honor, the glory, the thanks, and the praise, Father, for just being God. Thank you for how you kept us as we slept. Yes. And the heart was beating and the mind was regulated and the breathing, everything needed, necessary to do what we need to do for you. Father, you kept us. Yes, you did. Oh, it ain't gotta be. Yes, mother dear, I said ain't gotta be. Okay? It ain't gotta be a long drawn out, rehearsed, whatever prayer to say thank you. Thank God for everything you have, your faculties, the use of your arms and legs. And I'm going to tell you now, I've been, having a little bit of discomfort in my body. So I don't care what I look like. Evidence, the proof is in the pudding with the aging. Not as young as I used to be, but I tell God, thank you. So this is right on time for me. So dear Lord, bless the hearers of our message on tonight to be blessed. In Jesus' name we pray, amen. Now, before I get started in this, I want to go to the Word of God and I want to read in the book of Job, verse 14 through, let's see. Let's just read Job 14 through 16. And let's see, starting with verse 1. And then we'll just read until, this chapter is 14 through 16, but let's just start with Job 14 and start with verse 1. The Bible says, and this is King James, man that is born. We've heard this our whole lives. Man that is born of a woman is a few days and full of trouble. Okay? I'm not going to get stuck because we're going to talk about healthy aging. But that's verse 1. Born of a woman is of a few days. So guess what? It's going to be trouble. Not saying bad, whatever, but every day is not going to be sunny, shiny, okay? Even the process of learning how to eat, all of that, sleep, right? Okay. He cometh forth like a flower and is cut down. He fleeth also as a shadow and continueth not. And doth thou open thine eyes upon such in one and bringeth me into judgment with thee? Who can bring a clean thing out of an unclean? Not one. Seeing his days are determined, the number of his months are with thee. Thou hast appointed his bounds that he cannot pass. So basically, we know that every child born will one day die. Okay. And how we choose to do it or go, or the decisions that we have been given, are, at first they belong to our parents, and then they belong to us. And my husband and I, we had a discussion actually last Sunday when, we were, well, not last Sunday, the Sunday before that, when we were talking about Genesis, when God chose to breathe into the nostrils of man and not his mouth, when he gave him breath and life into him. And we talked about the fact that from that, the beginning of the creation of man, breathing into the nostrils gave us choices. That from that moment on, we had two nostrils, a choice. Okay? And so how we choose to take care of ourselves, unfortunately, it's given to our parents first. And if we have sedentary parents, many children are not introduced to exercise until they go to school. And they learn, go outside, run around, play this, that, and the other. And in my day, physical education was a part of the curriculum. And then anyway, it's not a requirement anymore. You were graded for PE. Not anymore. I don't even know if it's even, it may be extracurricular now, but it's not a requirement. So these habits and behaviors that we used to learn as a child, we're not forced to learn, right? And so healthy aging, unfortunately, there are so many people who start to do the things that are necessary when they're later in life, and their body says, oh, you move or you lose, right? And yeah, since I have been working from home, because, I always talk about myself and I disclose me. Since I have been working from home, wow, I realized that, you better move every chance you get. You have to get up out of that chair and move. The wireless headset that I have, believe it or not, I start at 5. It dies by 12 o'clock midnight. And then I have to switch headsets and wire myself to that seat or limit myself from 12 until 6. Yes, I am telling you, it's a battle and a struggle, but movement is essential. So the first thing that is presented is about your waistline. Okay, I'm just going to go through and read. Okay, and I want you to listen clearly. Watch your waistline. Watch your waistline. Don't be surprised if your doctor pulls out a tape measure at your next checkup. There's a growing awareness that the BMI, your body mass index, is an incomplete measure of obesity and a person's health status. So you can get on a scale and your height and weight says, oh, your BMI is nothing to worry about because you are between 25 and 29, okay? Ideally, you would want to be between, I think it's 25 and 27. I'm so sorry. But less than 30, we know you're not obese, but you are overweight. I think it's 27.5 and above, but the ideal is to be 25, right? Okay. Because they've learned about metabolic syndrome. They learned that your BMI may be good, but your waistline is telling another story. So watch your waistline. The BMI is an incomplete measure of obesity and a person's health status, and additional checks may be necessary. Writing in the Lancet earlier this year. Now, the Lancet is a medical journal or guide. An international commission of 58 obesity experts. International commission now. That's nationwide. International. That is global. Okay. 58 obesity experts encourage physicians to use more direct measures of fat on patients' bodies and assess their health risk on that basis. There are several problems with the BMI. A commonly used mathematical equation involving a person's height and weight. First of all, BMI doesn't take into consideration your muscle mass versus your percentage of fat, okay? You can have an elevated BMI or a high BMI and be mostly muscle. So I think I've mentioned this before. I would always say to people, your BMI is so-and-so. However, your muscle mass is high, and that's a good thing. Tops on the list is that it doesn't differentiate between bone, muscle, and fat. And that's exactly what I just said. Nor does it consider where the fat lies on the body. So when the fat is in your visceral area, which is not too far from the heart, the abdomen, the chest, that's not good. That's not where you push come to shove. If you want to be, and I hate to say this, okay, because I struggle with this now. Below the belt, not the tummy, but the hiney. Now, if you got to pick and choose where to carry your weight, I guess the butt side and the thighs would be better. Anyway, doctors can get a better look at patients' health by also measuring the waist circumference or calculating the waist to hip or waist to height ratio in addition to BMI. Fat, particularly abdominal fat, can be a dangerous effect on organs, paving the way for diabetes, cancer, and heart disease. All right. Now, let's move on. There's so much goody stuff here. Another fact to consider. Only 72% of adults age 50 and above who have been screened for colorectal cancer. So that percentage needs to be higher. And I actually got a little note here because we need to make sure that the colorectal screening is done appropriately, time-wise, because especially if there's a potential or family history of polyps. And how do you know if your family had polyps if they didn't get a colonoscopy either, right? But polyps can turn into cancer within 3 years, and that is the reason. Next, they stepping on my toes. Coffee time. Yeah, caffeine, not coffee, but caffeine. You can chalk up another health perk to your morning Joe. In the first study to investigate the best time to consume America's favorite beverage, researchers found that people who drink coffee in the early part of the day live longer than those who don't drink coffee. Okay, there's a limit here. The study, involving more than 40,000 respondents over 9 years, was published in the European Heart Journal. We found, and this is this doctor being quoted, we found that as compared with people who did not drink coffee, morning coffee drinkers had a lower risk of mortality from any cause, and cardiovascular disease mortality specifically, while the whole day drinkers did not show such associations. Well, morning coffee versus drinking coffee all day. Okay, 1 cup in the morning, but all day. Not good. The researchers aren't sure why drinking coffee later in the day doesn't appear to influence the lifespan. Moving on. Let's talk about alcohol drinking. 6% of adults age 50 and above who met their partners through online. Wait a minute. I'm sorry. Wait. Scratch that. I'm reading the wrong thing. I apologize. About that drink, and we're talking about alcohol. You might be rethinking your alcohol consumption after hearing the news that even 1 drink a day can elevate your cancer risk. They used to say a glass of wine a day, blah, blah, blah. Let me tell you something. There's a time and a season for everything. That's what the Bible tells us in Ecclesiastes, right? These health facts are like times and seasons. What year? I mean, the research. They do research on stuff and they put out information, but 5 years later they'll say, well, we used to think. Guess what I think? God, glory be to God. You need him as the reservoir, essential fountain, the middle of the road, the twine, the string that holds everything together, the every aspect of your life, everything. You need God. But I'm going to tell you what this says about healthy aging. But do keep in the back of your mind, you can't do nothing without him. And that is why we sang, because he lives. You can face tomorrow. I don't care what. Tomorrow gonna change, but it's got to be because he lives. All right. Hold on just a second. I need to grab something and I'll be right back. Please forgive me. I do need something. I'm back, and please forgive me. I didn't eat appropriately today, and I don't mind telling on myself. And I could feel my blood sugar dropping. So please forgive me. I'm going to talk and eat because I think you'd rather have me alive, right? You don't want me passed out on the set. All right. So we're talking about alcohol consumption. The risk is spelled out, okay, in an advisory issued earlier this year by the U.S. Surgeon General about the link between alcohol and cancer risk. Women have long been advised to drink no more than one alcoholic beverage a day, while men should have no more than two. But these limits may not be completely safe. Whoa. Look. All right. The advisory warns that any amount of alcohol raises cancer risk by some amount. And it's which cancer? Or I'm just telling you, look. Is it what's in the alcohol, the way they manufacture? What is it, right? I'm telling you, pray over every single thing you consume. You have to. So the advisory warns that any amount raises cancer risk by some amount. For women, consuming less than a single glass of wine, beer, or spirits in a week raises the risk of cancer by 16.5%. For men, it's 10%. Research shows that in the body, alcohol breaks down into a substance called acetaldehyde, and causes oxidative stress. Both processes damage the DNA, increasing risk for cancer. Okay? Alcohol also allows the body to absorb more carcinogens. From substances like industrial chemicals and tobacco smoke. That's why I was saying, like, anything that you consume. Is it actually the alcohol, or is the other environmental factors? It's all linked together. So when they say you are what you eat and then some. Things that you breathe in. That's why you have to have a healthy microbiome. I'm going to leave that alone. Go back and listen to the lecture. And in women, it raises levels of hormones. Oh boy, like estrogen, fueling breast cancer. Okay, well there's so many other things that can do that too. But anyway, to raise awareness, the Surgeon General called for an update to the health warning labels on alcoholic beverages to include cancer risks. Okay. Now, let's talk about exercise. Exercise for brain health. It's never too late, and I believe it wholeheartedly. It is never too late to reap the benefits of regular exercise. According to new research in a journal, Alzheimer's and Dementia, after people began to work out in midlife, their brains had less beta amyloid, which is a hallmark of Alzheimer's disease. In addition, those who exercise had increased thickness of the cortex, okay, the brain's outer layer, around structures that are key to memory and particularly vulnerable to Alzheimer's. The data are part of a larger investigation from Spain, which includes 2,700 cognitively healthy people between the age of 45 and 74 years old who are at high risk of developing Alzheimer's disease. The current study involved 337 of the study's participants who were followed for about 4 years. Previous research has linked greater physical activity with a lower risk for Alzheimer's. The association is particularly strong in midlife, when age-related brain changes start to develop. Okay? Yes, definitely the menopausal woman. Okay? And notes, okay, so that's from the study's author. And this is of the Barcelona Institute for Global Health. Midlife is a critical period in the context of Alzheimer's disease, as it is now well established that disease-related changes begin many years, often up to 2 decades before the onset of clinical symptoms. So get moving. But the thing that is the most important is to understand it is never too late to reap the benefits. Okay? I'm telling you, I talk about myself. Many times I have to push through. I have discomfort in places that it's just, I have to push through. And I'm being honest with you. I am being transparent. I don't tell you nothing that I myself do not have to endure or do. Okay? I am so thankful for my grandchildren because they keep me active. I was sitting on the floor doing all kind of stuff, right? Playing, crawling up under stuff. But to God be the glory. God gives us the tools, the instruments we need to do what we need to do. Thank God that we're not the first person that aged. The reachers, the grabbers, the shoehorn, the all kind of stuff. Whatever is needed, use it. The long arm Swiffer, whatever, right? Okay, now I'm jumping all around. I'm going through page to page, and we're talking about all kind of little subjects here. Here's a question and answer section about seasonal allergies in my 50s. Why does this happen? Suddenly have seasonal allergies in my 50s. Why does this happen? There are several possible reasons. The first is a reduced immune response, right? As we age, immune function declines and makes someone susceptible to certain conditions, such as seasonal allergies. Meanwhile, you may be exposed to new allergens with changes in your environment. If you move to a new location, for example, as you get older, you can become sensitive to allergens that you haven't been exposed to before. And I'm going to throw this out there before I even read it, but you got to have adequate sleep and eat. You got to eat. Yep, I'm talking about myself. Yep, I get so tied up in stuff and, I'm sorry, but I'm being honest, okay? All right. It says, also environmental change, such as increased pollution and climate change, can alter allergen levels and impact a person's symptoms. These factors also can cause seasonal allergies to worsen as you get older. At any age, having a family history of allergens can increase your risk of developing allergies. Sometimes I have trouble breathing from my chest. And this is a question. These are questions and answers. How can I tell if allergies are causing this shortness of breath? Allergies usually cause nasal congestion, post-nasal drip. Didn't we talk about that a minute ago? Yep. And maybe some coughing. I knew if I did not take care of the postnasal drip and lubricate my pharynx, the coughing was coming. Okay. If you have allergies, you can also have asthma. Okay. And there is also something called reactive airway disease, where your airways just react. And there is no definitive, say, well, I got asthma. Or you can, some people will be misdiagnosed as having asthma when they actually just have reactive airway disease. Okay. And reactive airway disease is a approved diagnosis which will allow you to have an inhaler, albuterol inhaler especially. But it says, if so, you may need an inhaler to treat the asthma in addition to allergy medications. You can also have allergen-induced asthma. Allergen-induced, where symptoms are triggered by exposure to allergens like pollen, dust mites, or even something else. Let's not talk about the something else. Okay. My recommendation is to have your breathing-related symptoms evaluated by a doctor with a spirometry test, which measures how much air you can inhale and exhale. Spirometry is often used to diagnose asthma. All right, here's another one. I've noticed that my seasonal allergy symptoms seem to be lasting longer than they have in the past. Why is that? Allergy seasons are getting longer and more severe because of climate change. That's because warmer temperatures and more carbon dioxide in the atmosphere are altering pollen production. Pollen seasons are starting earlier and lasting longer than in the past. And higher temperatures are leading to higher pollen production and more potent pollen. More potent pollen? Yes. And I believe you could tell the difference because that's that pollen that don't want to wash off easy. Okay. These factors can affect the duration and intensity of your symptoms. Once you start having allergy symptoms, it can take a long time to calm them down, which is why it's important to start taking allergy medications before you have symptoms and the floodgates open. And I know for a fact that I have lectured on that before. If you know your history, an allergy season is approaching. It's kind of like a load yourself up, right? You take your antihistamine the first sneeze. Okay? Don't wait until you keep sneezing. No, you take your allergy pill daily for about 5 days, at least 5 to 7 days, and then you take it as needed. Okay, during the season. And unfortunately, those seasons are getting longer, and then you tit for tat trade one for the other, and you end up taking the allergy medicine all year long. All right. Getting tested for allergies is important so you can pinpoint what you're allergic to and what you're reacting to. Now, many times it is not necessary to get allergy tested when you know that every time you dust, you sneeze, you're allergic to dust. How many people are? Many people. Or cats or whatever. Everyone doesn't have to get allergy tested unless it's severe and a simple antihistamine doesn't correct it, right? I always recommend that you cover your ear, nose, and mouth, okay, with a scarf. You're out in public, whatever. You take that scarf and you keep your ear, nose, and mouth. Those are the portals entry into the body, okay? All right. Let's see. The antihistamine. Here's a good one. The antihistamine I usually take for seasonal allergies has stopped helping me. Could I have built up a tolerance to it? The answer is yes. It is possible to develop a tolerance to an antihistamine over time. Now, me, myself, I have had allergies for years, okay? Ever since I was a little girl, I've had allergies. And when I got older, I had allergy-induced asthma. Then some of it was postnasal bronchitis. I had recurrent bronchitis. And that itself can irritate the bronchioles and worsen the asthma. And then I remember when I was a senior in high school, I had pneumonia. Okay. Anytime you get a pneumonia, you can have changes to your lung tissue. So long story short, the more often you get sick, and that's the reason why they ask you, how many colds a year do you get? You think they asking you that just to ask you that? No. It tells about your immune system. It tells so much about you. How many colds you get a year. It tells your stress, whatever, right? Okay, just saying. But yes, you can build up a tolerance to an antihistamine. And what I was going to say is, I've changed antihistamines probably, I can't even tell you how many times in my life. And I've actually gone back to one, stayed on that for a while, went back to the other, whatever. But so far, I've been on one in particular for a few years now. I'd probably say at least maybe 7 years now. Yeah, and it still works. And to God be the glory, I don't have to take it as often, but I do work from home too. So unless my house is making me sick, but I have been going outside more. So it is, it's what we do. All right. Factors that can play a role include taking the antihistamine for an extended period of time, taking higher than your recommended doses. Okay, people. And having a certain medical condition like COPD, chronic obstructive pulmonary disease, a lung disease causing restricted airflow. If you notice your antihistamine has become less effective, discuss this with your doctor. Your physician may switch you to a different antihistamine or have you temporarily discontinue the one you're taking and switch to a different one. Kind of like take a vacation from the one that you're taking and take another, that kind of thing. Okay. And sometimes after a break, your usual antihistamine can become effective again. It is very individualized how people respond to one antihistamine or another. All right, now, this is a goody. Are you what you eat? Can't stop without this one, right? And if I have time, I want to do the right moves. And then we're done. All right. Are you what you eat? Well, yes. You knew the answer to that. The fuel you give your body is directly related to how you look and feel and has a huge impact on your overall health. Read on to find out, blah, 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 blah. Okay, now let me say this before they even say anything about it. Let's talk about constipation. Let's talk about getting the trash out. Tell me what happens if you don't take the trash out of your house. What happens? It starts to stink. Your house ain't clean. The air ain't what. Okay, look. When a person is constipated, you got trash in the trash can and the trash can't come out. You're having a hard time taking the trash out. Okay? So you're weighted down, you feel sluggish, you feel bad. Having good bowel movements every day is essential for your health. And the potential for constipation and different things is even greater in elderly as you decrease your activity, you drink less water, all of that stuff, okay? So, are you what you eat? Yes. But remember, what you eat, there's byproducts and there's trash that needs to be taken out. So don't forget that either, okay? Now, it's no secret that our 50-year-old bodies have different nutritional needs than when we were younger. That makes it essential to choose wisely when eating so you can get enough of the nutrients that the older you requires. Decrease absorption, all of that. Here's the lowdown on what your body needs to keep healthy. Now, if we may end up stopping on this, but we may continue part 2 next week, but because this is some good stuff, okay? And then knowing me, I'll add something to it. And next week too is also Christmas, so I don't even know. Let me see how Christmas. I know I have to work. I do apologize, but let me look at this real quick so I cannot make any promises that I won't be able to keep. So yeah. The 23rd, I don't work. Yahoo! Woohoo! We'll be back. We'll do part 2. All right. So plan on protein. Now, I also recently did some research about not protein, but fiber. And so when we get to the part on fiber, I want you to know that you need to know your fiber. And I learned some new stuff about fiber the other night that I never thought to research. Okay, but we'll get there. All right, plan on protein. You may need fewer calories as your metabolism slows and physical activity lessens. So less calories, less carbohydrates, more protein sources, okay? But getting enough protein each day is important. The recommendation is to increase your protein intake since we tend to lose muscle mass with age. That's a given. Birth to death. You're going to lose, okay? And adults need 0.8 grams of protein per kilogram of body weight until age 70. Now, 2.2 pounds equals a kilogram. 2.2. So the average person is about 70 kilograms. Okay? So you do the math. So if 0.8 grams per kilogram, about 55 grams of protein for a 150-pound person. Woo, does 55 sound like a lot? Are we getting that much protein? You better start reading. Listen, my grandson loves peanut butter and jelly. And I told him that peanut butter was good for him. Natural peanut butter now. The good peanut butter. And not the processed with all the additives. And I showed him how many grams of protein there was in each tablespoon. Yes, I know he's 5, but guess what? He remembers everything else. He'll say, my gammy told me that I need to eat my protein. But anyway, that's a good example. All right. So at age 70 and beyond, this requirement increases. But guess what? It's easy. Because the math is 1 gram per kilogram of body weight. So about 68 grams of protein for a 150-pound person. Are you telling me that if I'm 200 pounds, I'm just saying, look, do the math, 1 gram of protein. Because once you lose your muscle mass, take it from someone who knows. It's hard to get it back. And you have to have muscles to move your extremities. You cannot move your arms and legs without muscles. The muscles are what contract to allow you to move them. And the tendons and ligaments are what allow the muscles to move. I pray it's making sense. Your calves are considered your second heart. Your calf muscles contract and allow blood to get back to your heart. So you essentially have two hearts in your body. One that's pumping blood to the legs and one that's pumping blood from the legs back to the heart. So it can go to the lungs and get oxygen, okay? But you got to have protein in your body. And we lose protein, especially if you're diabetic and you have proteinuria. The filtration system in your kidneys may be damaged and you might be losing protein. So you're eating a lot of protein and can't understand, because if you're peeing protein out, you're losing some. Okay, I said I was going to stay focused. All right, here we go. To get the amount you need, eat protein-rich foods such as lean meats and seafood. But you got to be careful with seafood with the salt. But still, seafood. Salmon, which each contains about 21 grams in a 3-ounce serving. Whoa. So if you are a little eater, small eater, you can't eat much, eat some salmon. I'm telling you now, 21 grams in 3 ounces. 3 ounces is not much. So you eat 6 ounces of salmon and you've already got 42 grams of protein. Drink you a couple of protein shakes. Come on now. Nibble on some cheese or eat a little bit of peanut butter on some wheat crackers or something. Come on. Yes, you are what you eat, and you can pick and choose. If you have to eat something, eat the right thing, okay? Don't forget your eggs. Oh, well, I'm sorry. Low-fat milk, 8 grams of protein per cup. You can put a little bit of milk in your eggs and cook them. Eggs, 6 grams of protein each. Now, I know they got cholesterol, okay? But egg, a little bit of milk, cheese. Getting your protein. Good job. And your plant-based sources such as nuts, seeds, and beans. Most supply at least 4 grams per ounce. There's a method to the madness. You can get it done. Find foods with fiber. All right, here we go. The U.S. government's dietary guidelines for Americans recommends that 45 to 65% of our caloric intake come from carbohydrates, primarily complex carbohydrates, which are whole grains, fruits, and vegetables, and legumes that are rich in fiber. Now, I've done this before where I told you that a high fiber carbohydrate, you're allowed to subtract the fiber from the carb and get net carbs. So what I'm saying is, if you're going to eat something, a carbohydrate, make sure it's high in fiber. Okay? Eating at least 21 to 28 grams of fiber each day is essential for normal bowel function, particularly as you age. A high fiber diet has also been linked to a reduced risk of illness, including heart disease, cancer, and diabetes. Now, let me tell you what I learned. I told you I was going to tell you. there's a difference between soluble and insoluble fiber. And I didn't realize that there are soluble fibers in certain fruits and vegetables. Okay, I'm not going to go through them, but do the research. Give you a homework assignment. Which fruits and vegetables are soluble or insoluble fiber? Because there are some that I had been eating thinking they were good and realized, girl, you ain't getting the fiber that you done ate. You ain't getting that much fiber out of that. Okay. Fiber can reduce your blood cholesterol if you don't want to take an anti-cholesterol medication. You get more fiber. And improve your blood sugar control. Research also shows that adequate fiber intake can positively affect cognitive function. So you mean think quicker, smarter, faster, cognitive function is improved with a high fiber diet? Okay. The best sources of fiber are whole grains. A half cup of high fiber cereal has 14 grams. Fresh fruits and vegetables. 1 cup of blackberries has 7.6 grams. A half cup of avocado has 5 grams. Beans. A half cup of kidney beans, 5.7 grams. I love my kidney beans. And nuts. An ounce of almonds is 3.5 grams. Now, watch your electrolytes. And I know I'm going over, but we're going to finish up Are You What You Eat? And then we will resume next week with part 2. And actually, we'll go back and give you a sample diet. And anyway. Because I want to tell you alternatives that if you are lactose intolerant, what you can use. And we've talked about that before. We're just piecing it all together. We're having a healthy aging talk, birth to death, before New Year's resolutions are made. Okay? But watch your electrolytes. Sodium and potassium can affect blood pressure, which typically rises with age. Just living long enough, you increase the potential to have higher blood pressures. Point blank. Not that you did anything wrong. Be sure to read the nutritional fact labels on your foods and limit to sodium intake to no more than 2,300 milligrams per day. That's a low sodium diet. Now, a normal sodium diet is 4 grams, but a low sodium diet, okay? And that equals to about 1 teaspoon of table salt. Cut that amount to 1,500 if you have high blood pressure. As for potassium, the recommended amounts are 3,400 milligrams for men and 2,600 for women per day. Choose potassium-rich foods such as lentils, bananas, broccoli, and leafy greens. If you have kidney disease or another condition that can impact your ability to process potassium, you may need to limit your potassium intake. So people who have renal insufficiency, the latter stages of kidney disease and dialysis, definitely do not try to increase potassium in your diet, or be very careful. Now, let's count on calcium. Calcium needs increase with age. It is recommended that postmenopausal women have 1,200 milligrams of calcium daily, which is best obtained through dietary intake. Men over 50 need at least 1,000 milligrams daily until they reach 70. Then the amount should be boosted to 1,200 milligrams. Now, I also want you to know, I see that that's the next section about vitamin D, so I'll wait. You need vitamin D to absorb calcium, okay? So if you're vitamin D deficient, take your vitamin D. I went on and said it, but I'm going to get there. Not getting enough calcium has been linked to an increased risk of bone fractures and osteoporosis, thinning of the bone tissue, and bone loss over time. Choose calcium-rich foods such as dairy products. A cup of milk has about 300 milligrams of calcium. Leafy green vegetables and calcium fortified products such as juices, cereals, and milk. Because you have your orange juice with calcium and vitamin D. If they used to charge you more, but now the price is the same. Ain't that nice? Calcium supplements should be considered for those who do not consume sufficient dietary calcium. Now, the supplements will constipate you. Okay, let's just tell it like it is. So it's recommended that you naturally get your calcium. It's easier, more tolerable for your GI tract and your body. Avoid a deficiency of D, and that's what I was saying about not being vitamin D deficient. Consuming enough vitamin D is important because aging skin is less able to change the natural sunlight into vitamin D. People be like, I be out in the sun all the time. I don't know why. Because your skin is changing as you age. Come on now, you see it. No wrinkles. You're not smooth anymore like you used to be. Stretch the skin out, right? Anyway. A vitamin D deficiency can inhibit calcium absorption, and adequate amount of vitamin D along with calcium are crucial to preventing bone loss. Adults need 600 international units of vitamin D per day, while men and women over 70 need 800 daily. Since vitamin D is not widely abundant in foods, include vitamin D fortified foods such as dairy products, plant milk alternatives, orange juice, and cereals in your daily diet. Beef up the B12. As you age, your stomach acid volume decreases, so your body may not absorb B12 as well. Vitamin B12 helps keep your body's blood and nerve cells healthy. To be sure you're getting the recommended daily allowance of 2.4 micrograms per day, consume lean sources of animal protein, such as ground beef, fish, and milk. Vegans should look for fortified foods since vitamin B12 is primarily found in animal products. Okay? Lighten up on iron. The need for iron decreases for postmenopausal women because they're not bleeding every month. Okay? Women over 50 need just 8 milligrams of iron each day, compared with 18 milligrams that menstruating women need. No change is recommended in the amount needed for older adult men who also require 8 milligrams. The best sources include red meat, poultry, fish, and enriched breads and cereals. So, ding, ding, ding. What have we talked about that is so healthy, right? Fish. Salmon. Every chance you get, you go out to eat and they got salmon. I guess we should get the salmon. Yep, I'm gonna start eating. I used to eat it till I got to the point where I got tired of it, but I think I need to go back. Okay. And there are enriched breads and cereals. Avoid multivitamins with added iron if your diet is rich in iron, unless your physician advises otherwise. I will say iron will constipate ya. So if you're doing iron and calcium supplements, try to find ways to supplement with your diet. Now, the last one that we're going to talk about tonight is the benefit of lutein. Research has shown that lutein plays, and that's Lutein, plays a role in helping save eyes from age-related macular degeneration, a disease that can cause vision loss. Lutein is found primarily in egg yolks. Oh boy, they tell you not to eat all them egg yolks because of the cholesterol. But guess what? It didn't say you had to eat 10 of them. Okay. But so if you, and produce such as, and produce such as spinach, broccoli, red grapes, and oranges. Okay. So there's other sources if you have a cholesterol issue. Okay. All righty. Tonight, healthy aging from birth to death. And we'll have a part 2 next week. And then I want to tell you about my job as a healthcare provider as a nurse for so many years and being instrumental from birth to death in lives of people, and why we are talking about healthy aging. Because you are going to age. You cannot avoid aging. It is inevitable. You will age. But can you do it healthy? Yes, you can. And it's never too late to start. Never too late. Stop in your tracks. Do you know a person who has COPD or has a lung disease from smoking? Do you know that if they quit smoking, that they can revert some of the damage done or stop it in its tracks? Just stop smoking. Anyway, to God be the glory. God bless each and every one. This is Dr. Anna Shaw Devlin. I am a family nurse practitioner, and I love what I do. I truly do. And I love each and every one of you. That's why I am willing to do what I have to do to present information that will allow you to live a healthier life. God bless, and we'll see you again soon. Adios, amigos. Pastor Devlin will be with you on Sunday. All right? Take care.